Hey everyone, my name is Dr. Shah.
I'm Dr. Maxfield.
Welcome back to our channel, Doctorly, where we hit you with high-yield skincare information, dermatology content, and medical content. Today, we're going to be talking about 3 mistakes we've seen people make with skincare and how you can avoid them. Here we go.
Okay, first let's start with you. Can you show them your shoes? Matching. Shoes to match the scrubs.
Yeah, my shoes always match my scrubs.
Yeah, you know he's the right one to be talking to you for this. What's the first thing that you feel like you've seen your patients do?
All right, so if you guys follow me on any of my other platforms, Instagram, TikTok, you know, this is my biggest thing, is that do not use too many new skincare products at the same time. This is super common, and the problem is a lot because companies sell these kits of skincare products that have step 1, 2, 3, 4 through 10, and then you're using 10 new products at the same time. First of all, it's overwhelming. It becomes too much, and then it's hard to stick with it, and you end up giving up. Number 2 problem with that is that if you have an allergic reaction, which is pretty common to have an allergic reaction or too much sensitivity to a new skincare product, you don't know which product caused it, and then you kind of have to scale back on everything and start over, wait for your skin to heal, and it becomes this really laborious process. And so I would say that's my biggest problem, is when people use too many new skincare products at the same time. Instead, what I recommend that you do is to just introduce 1, maximum 2 new products at a time, wait a month, and then introduce a new product that helps target your specific skincare concerns.
So the first thing he says to me this morning-ish, other than like, "You're not here yet." And I said, "Yes, I am. I'm already upstairs. Where are you?" But he says, "I'm using this new product. It's revolutionizing my under eyes." And then he says, "But I don't know which one because I'm using so many things on my face."
Yeah, none of us are perfect, so I actually did say that this morning. So I'm using 2 eye creams at the same time, and I don't know which one is having the benefit, so we have to kind of decide later on. We'll talk about this later when we talk about eye cream.
So my first one is having set goals, realistic goals. If you go into a doctor's office and you say, I just want to look better, you're really not giving them any information to help improve some of the things that you would want to improve upon. And part of it also goes into having looked at yourself, having identified some things about you that you would want to compliment. Because if you're wanting to leave an office, you're wanting 6 months or a year down the road not to look like you at all, you're going to be disappointed. All of us has asymmetries. All of us have some features that are larger or smaller than others. And when you're introducing yourself to the cosmetic world, you don't want to just transform your face. You want to compliment and bring out things that naturally make you you and are appealing about you to others.
That's a good point. Yeah, you need to have a specific skincare goal. A lot of people say, "Hey, make me a skincare routine." And I say, well, what are your goals or concerns? So if you have acne, your goal may be to eliminate your acne. If you have melasma, you may want to have more even pigment in your skin. And so those are realistic goals, and we can target certain active ingredients towards those specific goals. But if you don't have a clear goal of what you want to see, first of all, you're going to be disappointed because you'll never reach sort of that finish line on that. And also, you won't know what skincare products to use.
All right, number 2.
My number 2 mistake I see people make is copying other people's skincare routines. And so we all watch a lot of YouTube. We watch TikTok. We see people's skincare routines, celebrity skincare routines, and we see what they do, and then we go out and we buy what they bought. But we all have different skin issues. Like we said, we want to target things that are specific to you. And so if you're watching a YouTuber that has perfect skin, it's more of a combination skin type, but you have oily, acne-prone skin, don't use the same routine as them because it's not going to work for you. You're going to spend a lot of money, and then you're going to be really disappointed.
Solid. Number 2 for me is giving things enough time. Now, that part of that's on us. He's looking at me because this is actually kind of like his number 2, but it's also mine.
Okay, first of all, I'm not doing this anymore. Okay, so we come in this morning, and he says to me, "What are your 3 tips?" And I go, "Well, I'm not going to tell you my tips." But then he said, "No, I want to know." And so we don't make the same tips. And so I told him that I said, stick with the same skincare product for at least 2 to 3 months. And then he came and just stole it.
Hey, I had the same tips, same high yield facts, or the same high yield facts. All right, I'll touch on one part of it. I'll touch on our side of it. So when you come to us with an identifiable goal, something set for us to help you achieve, when I talk to my patients, I'm very, very candid with them and try to set a very realistic time frame and say, hey, look, this is something that you need to be consistent with over 6 months. And you may actually have a hard time noticing a difference on a day-to-day basis, a weekly basis. But 6 months later, you're going to look down the road and you're going to look at an old picture and say, wow, that's an improvement. Or someone's going to come up to you and say something similar. So most of the things, especially with topicals, they take a long time to make a noticeable improvement. And so when you're talking to someone like us about this, ask those questions. Make sure you have an idea in mind as to when you can expect some results.
So actually, this is an important point that you bring up, Dr. Maxfield, about how long it takes skincare products to work. We study the biology and the physiology of the skin through dermatology, and so we know that it takes about 30 days for new skin cells to form at the top layer of your skin, and it can take longer as we mature. So as we get older, this can go from 30 to 60 days. And so if you start a new skincare product and the point of it is to exfoliate, it may take several months for you to see improvement in your skin. And then things that build collagen take even longer to form and see a difference with. So if you're using a retinoid to eliminate fine wrinkles, this may take several months to see any benefit. One of the things that may work a little bit faster is something like a moisturizer, because it prevents transepidermal water loss, and so you should see a hydrating effect within a week or two, I would say.
Yeah, that's fair. Okay, I'll go with my number 3 first, just so he has a chance to steal it. My number 3 tip is do your homework. This involves you kind of taking some time to investigate what things and what are the limitations of what you can get over the counter, what a dermatologist has to offer, and what a plastic surgeon has to offer through the operating room. A lot of times people come in and they even ask for something like Botox to fill in like very deep wrinkles or like the folds right here. This. Wait.
What is he doing?
Can you see it? One of the most common things I see people beginning their walk through cosmetic dermatology is even just identifying the difference between Botox and filler. They have very different roles. They fix very different issues. And so knowing what people have to offer you and what the things will actually treat is going to save you a lot of time. It's definitely going to save you a lot of money. And it's definitely going to help you get the results you want. Solid number 3.
The third biggest mistake that I see people make is to rely on anecdotes. What is an anecdote?
Okay, an anecdote is something like I go to Taco Bell. I eat, 6, 7 normal, whatever the normal thing is, burritos. And then I get the stomach virus and I'm sick.
And then he says, well, Taco Bell gave me this stomach problem. But I love Taco Bell, okay? Like even they got me a gift card to Taco Bell for my birthday. So I know that doesn't do that, right? So that's an anecdote, saying that something happened and it's going to happen to you too, without any scientific evidence that that's in fact true. So what I mean by that is that when someone comes up to you and they tell you, hey, I did this thing for my skin and it cured my acne. So I rubbed dirt on my face and it cured my acne. That's an anecdote. It can't be applied to a large population of people. It can't be said this is going to cure everybody's acne. The way that you could prove that is to do a study, take 100 people, rub dirt on their face if they have acne, and see if that improves their skin. And then you could call that a scientific study, and then we could generalize it to the population and say everyone should put dirt on their face if they have acne, right? And this is how we come up with our skincare product recommendations, is based on studies that prove that certain products are effective. So for acne or things like salicylic acid, benzoyl peroxide, retinoids, azelaic acid, these things have been proven to be helpful for acne, right? So anything that you say may work for you is great, and continue to use that for yourself, but don't rely on an anecdote if there's no real scientific evidence that it actually works. I would say you can try things that are trendy or something that your friend has recommended to you, but first rely on things that have proven scientific evidence that they work. And the reason I say that is because you'll be much happier with your progress. You won't be likely to give up because you'll start to see results on things that have been proven to work.
Yeah, it's compelling, very true. Thanks for tuning in.
Thanks for tuning in. Like, comment, subscribe, hit the notification bell. We're going to be hitting you with skincare content 24/7, 365.
364.
What?
We take days off, remember?
We do? Oh, yeah, we do. We take a day off. We take one day off a week. All right.